Achalasia Cardia is a rare disorder that affects the esophagus. As future doctors, it's important to understand this condition. This knowledge will help you diagnose and treat patients effectively. This essay will guide you through the intricacies of Achalasia Cardia. We'll cover its causes, symptoms, diagnosis, and treatment. Imagine a tube that carries food from your mouth to your stomach. That's your esophagus. In Achalasia Cardia, this tube doesn't work properly. This can lead to discomfort and difficulty swallowing. Understanding this condition is crucial for providing the best care for your patients. Achalasia Cardia affects the lower esophageal sphincter, or LS. The LES is a muscular valve at the bottom of the esophagus. It acts like a door, opening to let food pass into the stomach and closing to prevent backflow. In Achalasia Cardia, the LES doesn't relax properly, making it difficult for food to pass. This malfunction is primarily due to damage in the nerves of the esophagus. This disruption prevents the LES from receiving the signal to relax and open. Consequently, food accumulates in the esophagus, leading to various complications. While the exact cause of Achalasia Cardia remains unknown in most cases, several factors have been linked to its development. These include the degeneration of nerve cells in the esophagus, autoimmune disorders, and certain viral infections. Additionally, genetic predisposition might play a role, as some families exhibit a higher incidence of the disorder. However, further research is needed to pinpoint the specific genes involved and their mechanisms. Achalasia Cardia often presents with a range of symptoms, which can vary in severity from person to person. The most common symptom is dysphagia, difficulty swallowing, especially with solid foods. Other symptoms include regurgitation of undigested food, chest pain, heartburn, and unexplained weight loss. If you encounter a patient presenting with these symptoms, it's essential to consider Achalasia Cardia as a potential diagnosis. Section 5. Diagnosing Achalasia Cardia. Diagnosing Achalasia Cardia usually involves a combination of tests to assess esophageal function and rule out other conditions. The most common diagnostic procedures include a barium swallow, endoscopy, and esophageal manometry. A barium swallow uses X-rays to visualize the esophagus as the patient swallows a barium-containing liquid, revealing any abnormalities in shape or movement. Endoscopy involves inserting a thin, flexible tube with a camera into the esophagus to directly examine its lining. Esophageal manometry measures the pressure and coordination of muscle contractions in the esophagus, confirming the diagnosis. Section 6. Treatment options and management. While no cure exists for Achalasia Cardia, various treatment options aim to relieve symptoms and improve quality of life. Treatment typically focuses on relaxing or widening the lower esophageal sphincter, or LES, allowing food to pass more easily into the stomach. Common treatment approaches include pneumatic dilation, which involves inflating a balloon inside the LES to stretch it, and myotomy, a surgical procedure that cuts the muscle of the LES. Peroral endoscopic myotomy, or POEM, is a minimally invasive procedure that accesses the LES through the mouth to perform the myotomy. Section 7. Potential complications. Untreated Achalasia Cardia can lead to various complications, some of which can be severe. One significant risk is aspiration pneumonia, which occurs when food or liquid enters the lungs due to esophageal obstruction. Other potential complications include esophageal perforation, a tear in the esophageal wall, and megaesophagus, a condition where the esophagus becomes significantly enlarged. These complications highlight the importance of timely diagnosis and appropriate management of Achalasia Cardia. Section 8. Prognosis and outlook. The long-term prognosis for individuals with Achalasia Cardia largely depends on the severity of the condition and the effectiveness of treatment. Early diagnosis and intervention generally lead to better outcomes, with most patients experiencing significant relief from symptoms. However, it's important to note that Achalasia Cardia is a chronic condition, and follow-up care is essential to monitor for recurrence or complications. Patients should be educated about lifestyle modifications, such as eating smaller meals and avoiding trigger foods, to manage their condition effectively. Section 9. The importance of early detection and treatment. Early detection and treatment of achalasia cardia are crucial for improving patient outcomes and preventing complications. As future healthcare professionals, you play a vital role in recognizing the signs and symptoms of this disorder and referring patients for appropriate evaluation and care. By staying informed about the latest advancements in achalasia cardia research and treatment, you can contribute to improving the lives of individuals living with this condition. Remember, your dedication to ongoing learning and patient-centered care can make a significant difference.